Good evening. I'm State Senator Jamie Eldridge, and welcome to the Mass Democratic State Committee Public Policy Subcommittee webinar on COVID-19 vaccines and the mass vaccination plan. Thank you everyone for coming. I serve as one of the co-chairs of the Public Policy Subcommittee alongside Martina Jackson, who's done tremendous work in organizing tonight's webinar, as well as Ann Roosevelt and Ralph Edwards. So the four of us co-chair this public policy subcommittee. And one of our missions is bringing information, bringing issues to the general public, but organized, of course, through the Mass Democratic Party. And we have a terrific panel of doctors, as well as a director of outreach for the Brazilian Worker Center. We'll talk about some of the equity work she's doing. Questions include presentations. What are the differences between vaccines? What about the variants? How do I make an appointment? We're seeing a lot of progress, obviously, on people getting vaccine across Massachusetts, but there still is a long way to go. There's a tremendous amount of equity work left to do in terms of racial and economic equity, as well as other areas. And we reached out to some fantastic doctors to do presentation on some of their work and to answer questions from people, which after the presentation, people are welcome to put those questions in the chat. And so without further ado, I'd like to introduce the first panel. And so I'm just introducing them by their titles. Each of them have very distinguished education and work and healthcare backgrounds. First is Dr. David Duong, who is a member of the Boston Ward 19 Democratic Committee, but he's also a primary care physician at the Brigham Women's Hospital. We also have Dr. Wilfredo R.Matias, who's the chief resident of the Global Health Equity Residency at Brigham Women's Hospital and a clinical fellow at Harvard Medical School. And then we have Dr. Paulette Chandler, co-investigator on the NIH Moderna COVID-19 vaccine study. And really, really grateful for each of you presenting tonight. So with that, I'm gonna hand it over to the first panel. And again, thank you so much for joining us. We hope this is educational and hope you can help join all of us in spreading the word about vaccinations, as well as facts around it and how to make sure everyone in Massachusetts is healthy and safe. Thanks so much.
Great. I'm so glad that you all are joining us tonight for this important discussion. I'm just going to share my screen and then we'll get started. And please, if you have questions in the middle of the presentation, feel free to jump in. All right, so we're talking about COVID-19 vaccines, and of course, we currently have 3 that are available. And we'll start off that, we know that we need to get vaccinated, and it's important that everyone that can get vaccinated choose to get vaccinated, because that's how we protect ourselves and we protect others in our community, and we help keep everyone healthy in our community. So how do these preventive vaccines work? You may have had childhood vaccines, and polio is the number one that you think about, or mumps, measles, rubella. And they are important in the sense that they are the way your body learns to respond. So you're given a vaccine that has material that looks to your body like a virus or bacteria. Then your body makes antibodies to fight it off. Antibodies are like the weapons that your body develops to prevent your body from getting infected by the virus or bacteria. Then if you encounter that disease again, your body says, I remember this bacteria virus, and your immune system immediately responds and starts to make these antibodies that prevent the virus from causing severe disease. So how are vaccines developed? First, there's the discovery phase where scientists say, I think I know what this looks like. So they identify what the virus or bacteria is. And then they develop a vaccine that may work. They try it in animals, make sure it's safe in animals, and then they move to the human studies. And clinical trials are used to study these vaccines or other medications in humans. Phase 1, 20 to 100 healthy volunteers, usually young people. Then phase 2, the goal is to say, are there short-term side effects? Does the body mount an immune response? And then phase 3 are studies where we have thousands and thousands of individuals that agree to participate in the study. And that's where we get the information about, is it safe? Does it work? Safety and efficacy, does it work? And then of course, now we move into the emergency use authorization, which happens after we have phase 3, where thousands of people are involved in these clinical studies. And of course, there are different types of vaccines for COVID. There's the weakened or inactivated virus. And of course, we don't have that, or piece of the virus, which would be like the adenovirus. And then we have the messenger RNA, which is just the recipe for spike protein. The spike protein of the COVID or the SARS-CoV-2 virus is the way that the virus enters the cell. So the messenger RNA provides like a recipe, and it instructs the cells how to make the spike protein. Then the immune system sees the spike protein and it makes antibodies against it. Now, it's important that messenger RNA vaccines do not enter the nucleus of the cell. So there's no interaction with the genetic material. It just stays in the outside the nucleus, and the body, the cells, make the spike protein. And then once the enzymes, once the spike protein is made, then enzymes degrade. They break down that messenger RNA. And there's no live virus involved in messenger RNA. So you can't get COVID from the vaccine, because a common question is, will I get COVID if I get this vaccine? No, because there's no live virus, no COVID injected when you receive a messenger RNA virus vaccine, or even the adenovirus vaccines like the Johnson & Johnson. And that's the Johnson & Johnson. What about the Johnson & Johnson? So it's not a messenger RNA vaccine. Instead, it's an adenovirus. So the spike protein gene, genetic material, meaning the instructions for the body to make the spike protein, that's what's injected into your body if you get the Johnson & Johnson. And then the body produces the spike protein. So in all these cases, the target is the spike protein that your body's learning how to make, so that when it sees it again, it will have the appropriate response. How effective are these COVID-19 vaccines? Well, with Pfizer and Moderna, they're 95% efficacy, meaning that if you were to get infected with COVID or exposed, that you would have probably about 95% protection against getting severe infection or dying from the disease. And what we call severe infections, like hospitalization requiring, visit to the intensive care unit, requiring ventilator, having to support your breathing. And then for the Johnson & Johnson, 70 to 85% efficacy. Will the vaccines be effective in people of color? Well, yes, because these trials all recruited diverse populations so that we can know, does it work in Blacks? Does it work in Latinx? Does it work in Asians? For Moderna, it was 63% white, but 20% Latinx, 10% Black, and 4% Asian. And then for Pfizer, 6% Asian, 10% Black, 13% Latinx, 70% white. So we have a diverse group represented in the clinical trials. And of course, also people with a variety of underlying health conditions, hypertension, diabetes, underlying lung disease. And it was safe in these various groups. And now, of course, we've had millions of people vaccinated across the US, and we're seeing similar safety profiles. And that's just Johnson & Johnson data in terms of showing you the diverse groups, diverse, race and ethnicities that are represented in the trials. And I'll let Wilfredo go about in terms of the vaccine potential side effects for the COVID-19 vaccines.
Fantastic. Thanks, Dr. Chandler. Great. So now let's talk a little bit about reactions and side effects secondary to the vaccine. So As of today, there have been about 150 million people that have already gotten at least one dose of one of the 3 COVID vaccines that are available. And there are a little bit over 100 million people that have gotten a full course of their vaccinations. And so we really now do know a lot about what to expect when people get their vaccine. So I'll talk a little bit about that. So first thing here is, what are common side effects? And so these are side effects that many people will have after they get vaccinated. The most common side effect that people tend to get is that they'll have pain at the site of injection. And essentially that is, you'll feel a little bit sore, either on your left arm or your right arm where you got the vaccine, and it'll tend to go away after a couple of days. People also report fatigue, so they'll feel a little bit tired afterwards. Some people get headaches. And less common, but still some people do report having some body aches and fevers after their vaccination, after their vaccinations. So if you can imagine, after you get your first vaccine, your body's already kind of revving up and mounting an immune response. And so oftentimes something that we do tend to see is, because your body's kind of ready to go because they've gotten one vaccine, is that when people get the second vaccine, they can get some of these similar symptoms, and they tend to be a little bit worse sometimes. And one of the points that I'll highlight here is that even though these side effects make you feel a little bit uncomfortable if you do get them, and some people, get concerned because they think that they're very ill, these side effects are really not life-threatening. And essentially, it's just a sign that your body has recognized the vaccine and it's doing what it needs to do to develop the immune response and build the antibodies that protect you. And for these symptoms, we usually recommend that people take either Tylenol or ibuprofen after they get vaccinated to help treat these. Next slide. Great. And so we'll keep walking through and talking a little bit more about some other reactions. This is one that some of you may have heard of, and it's something that we call a local arm reaction. This is a side effect that doesn't usually tend to happen in the first few days after vaccination. Usually what happens in people who do get it, which is uncommon, is that nine days or so after you get the vaccine, you'll develop a little bit of redness around the site of where you got injected. It'll itch a little bit, and then it tends to go away on its own after a few days. And it's really not a contraindication for you to get your second dose or anything like that, but just something to be aware of that can happen sometimes. The third major thing, and this is one that people tend to worry about, is this problem of anaphylaxis, which is one of the more concerning potential reactions that we see with vaccines and with any other medication, really. So what is anaphylaxis? It is a life-threatening allergic reaction that can occur rarely after vaccination, and it usually happens within minutes to an hour after people get the vaccine. This is the reason why after people get their vaccine shot, we usually keep them in the vaccination area, and we watch them for like 15 to 30 minutes just to make sure that everything's okay. And so even though it is, it is a concerning reaction, it's something that thus far has been incredibly uncommon. Nobody, to our knowledge, has died from an anaphylactic event from a COVID vaccine. And the data that we have so far show that with the Pfizer vaccine, there tend to be about 4.7 cases per million people that have gotten the Pfizer shot, and about 2.5 cases per million people who have gotten the Moderna shot. And so far in the Johnson & Johnson trials, they haven't seen any anaphylactic events. So very, very low number of cases, so very much a rare event. And just to compare it to other vaccines, so this happens with the flu vaccine, it's about 1 case per million people. Same thing with penicillin, and tends to be even more common with other things like contrast that we use sometimes in medicine for radiology purposes. So a concerning reaction, but very much a rare one, and one where we have procedures in place to treat if it were to happen. And now moving on to the Johnson & Johnson vaccine. So as many of you know, this is a single dose vaccine, so you only take it once. And most of the side effects, I won't repeat them here because they're essentially the same as Moderna and Pfizer. You can get a little bit of pain around the injection site, some redness, and then feeling tired, having headaches, muscle aches, etc. The percentage of people that get these are a little bit different, but it's really quite similar to Moderna and Pfizer. So we'll continue. And so, we'll address this because I know a lot of you guys are probably thinking about this because this has been in the news, pretty frequently over the last month or so. So as many of you know, earlier in the month of April, the Johnson & Johnson vaccine was briefly paused while the CDC and the FDA investigated these cases of 6 people that got a blood clot in the blood vessels that surround the brain. And so they paused the distribution of the Johnson & Johnson vaccine to investigate that and try to understand the reasons why. And so I'll say that, the fact that this happened is very much a testament to the fact that the systems that we have in place to make sure that vaccines are safe are working really, really, really well. If you can detect 6 cases from 7 million, then you're really good at identifying adverse events and side effects. So after they found this, the CDC and the FDA got together, they reviewed all the cases in depth, they reached out to other people who had gotten the vaccine and to providers, and they noted that these episodes were mainly in women between the age of 18 to 14, and that most of the cases happened within 2 weeks. And their consensus after this meeting was that these events were so rare that we would go ahead and continue using the vaccine because the benefits essentially outweigh the risk. And essentially our counseling now is that, for anybody who gets this vaccine, if they get any of the symptoms on this slide here, so really bad headache, neurologic symptoms, et cetera, that they should call their doctor. Great. And then just rounding out the list before we continue, just commonly asked questions about side effects of the vaccine. A lot of people wonder if there are certain medications that we shouldn't take with the COVID vaccines. There really aren't any specific medications identified yet. People who are on medicines that lower the immune system should be aware that the vaccine may not work as well. And those people, we recommend that they talk to their doctor because this is something that should be discussed on a case-by-case basis. A lot of people are wondering if they should consume alcohol after taking the vaccine. No official rules, again, although there is a theoretical possibility that if you drink a lot of alcohol after you get vaccinated, then maybe your immune system won't react as well as we would hope it to. And then the other thing to note, and this one is important here. So, the vaccine, the COVID vaccine should be separated from other vaccines, just to kind of give time for individual vaccines to work. So you shouldn't get vaccinated with anything else within at least 2 weeks from getting your COVID vaccine. And with that, I'll hand it over to Dr. Duong, who will take us through the rest of the presentation.
Great. Thank you, Dr. Matias and Dr. Chandler. So I just really want to reiterate the point. The risk of becoming ill with COVID-19 or dying from COVID-19 is so much higher than the risk of a severe reaction to the vaccine. We can treat the severe reactions. We have really good medications to treat the severe reactions. And like Dr. Matias said, it's really rare. It is so rare. Whereas the risk of dying or being in the ICU, being on a ventilator is really high. And the risk of death you see here on the slide from COVID-19 is 3.4% or 1 in 30 people, whereas the risk of a severe anaphylaxis reaction, which we can treat, and we have a lot of experience with treating, is no greater than 1 in 200,000 people. So that's just to help put it into perspective for you. So who is eligible in Massachusetts right now? everyone is eligible over the age of 16. It's really amazing that our country and our state got to this point in history when just less than a year ago, this virus was found. We were busy making this vaccine, and now everyone over the age of 16 is eligible for it. So if you're over the age of 16, please go and sign up to get the vaccine, and we're going to talk about how to do that. So how do you get the vaccine? So this is a great site, vaxfinder.mass.gov. I was just on it this morning. All you have to do, if you have an internet connection through your mobile phone or through a desktop, is put in your the name of your town or your zip code, and then it's going to populate all of the vaccine sites that have eligibility. And as of this morning, most of the vaccine sites in this state, you can schedule a same-day appointment. How amazing is that? So please go to online to do this. If you don't have a phone, you can call 211. That number is available both in English and in Spanish. And you can follow the prompts and they will connect you to a live person. I was connected within about a minute or so this morning on the English version, and they will connect you to help you get a vaccine. If you need transport to help you get to your vaccine, if you need childcare support to help you get to your vaccine, call 211. They can help connect you with the community resources that can help you do all of that. If you are homebound, you can also call 211 and they can schedule someone to come out and get a vaccine for you or connect you with the right resources. We have a lot of tools. The state has invested a lot. The city has invested a lot to help you get this vaccine. You can also find more more information on the vaccine at mass.gov /COVID-19 vaccine, and it's going to answer all of your questions for you as well in multiple languages. I think over 6 languages. They will have information sheets that you can share with families, with friends, with your church groups, with your community groups, play groups, etc. And then if you have any other questions, you can contact the Governor's Office for Community Affairs, which is that number right there listed on the screen at 617-725-4005. And then last but not least, if you want to just talk to a trusted medical provider, someone that you have a really good relationship with, call your primary care doctor, talk to your primary care doctor, and they can really take the time, answer the vaccine questions for you. And then also, depending on their system, but I believe most systems now, they can schedule a vaccination appointment for you as well. Okay, so now it's really time for all of us to do our part, to step up. This time last year, doing your part was staying at home, not going out, masking up, social distancing, and making those sacrifices. This time in 2021, to do your part for the community, it's really to get vaccinated so that we can reach that 70% to achieve herd immunity. What does that mean? That means that if only a few people are vaccinated, then if one person's infected in the community, even though only a few people, so the magic number is 70%, then the the virus can continue to spread. Whereas if you look on the other side of the screen, if lots of people are vaccinated, those in the blue, that one person who's infected, the orange cartoon, they have the virus does not spread as much anymore because most of the people are vaccinated, and that's what we mean by herd immunity. So that's what you have to do this time, and that really means not just vaccinating for yourself, but for your family members, for your friends, for everyone in your church group, in your community groups, in your knitting circles, quilting circles, at the hair salon, all that stuff. One of the first questions I love to ask people now is, how do they feel about the vaccination? Have they got vaccinated yet? Have that be a conversation topic. It can be really uncomfortable, but do it because that's your part. We did such a good job in the state trying to socially distance, and everyone worked well with that. So now it's time for this so that we can get back to normal. Next slide, please. So now with that, we can take questions and answers that you may have. Thank you so much.
Great. So Dr. Duong, thank you so much. Dr. Matias and Dr. Chandler, really appreciate this panel presentation. And I going to have Dr. Natalícia Tracy do her presentation now, and then we'll we'll have Q&A just after. So I see Dr. Tracy on the Zoom. And so let me just introduce her. But I first just want to say, I really appreciate your presentations, because I think that what is so critical is that while certainly elected officials can do our part to let our constituents know, about all of the facts around vaccines and vaccinations, it really takes sort of trusted medical officials, whether doctors, whether public health experts, to really, I think, bring a comfort level to residents across Massachusetts to get vaccinated. So really appreciate your presentation, all of your obviously incredible work. And we're obviously now at a point where majority of residents have been vaccinated, and the reality is really seen from the past year is it's really highlighted racial disparities, including racial health disparities, and we're really having greater challenges to make sure more people are vaccinated. And so it's my honor to introduce, to talk about her just incredible equity work, Dr. Natalícia Tracy. Dr. Tracy is the executive director of the Brazilian Workers Center and a lecturer of sociology at UMass Boston. Been at the Brazilian Workers Center since 2010, where she's worked in educating members of the immigrant community on the racial divides that immigrants carry with them from Latin America to Boston, and is also co-founder of the Massachusetts Coalition for Domestic Workers, and helped lead the campaign to pass the state's 2014 Domestic Workers Bill of Rights, which I was very proud to work with her on. She's here to talk more about the Brazilian Workers Center efforts to dispel vaccine hesitancy and overcome barriers to access. And before I ask her to speak, I would just say, someone with a Metro West district that has one of the largest Brazilian American communities in Massachusetts, many of my constituents have gone to the Brazilian Workers Center, where they've had an equity vaccine clinics for many weeks and many weekends. Absolutely critical, creating that comfort level that for a variety of reasons, some of my constituents did not feel comfortable maybe to go to the local hospital or go to a mass vaccination site. So Dr. Natalícia Tracy, thank you so much for your great work. And if you could offer your comments and wisdom, we greatly appreciate it.
Thank you. First of all, good evening, everyone. And I am really appreciative of this space. As the executive director of the Brazilian Workers Center, we have, that the immigrants and people of color, they have experienced a great deal of inequality. And the COVID-19 pandemic really heightening awareness of those inequalities. And last year, when COVID hit, we found ourselves having to expand our services to support our community in ways that we never expected. And so we helped our community and provide them with different types of assistance, with food assistances, with rent relief, and other types of support. But then we also were talking to our community since October about vaccine, right? Because it was really important that our community understood the importance of getting vaccinated. There's vaccine, what do you call it, hesitancy. People don't want to vaccinate it because it lacks trust in government. You have to remember, we also were living we were hoping at that time to exit a national administration that really were prosecuting immigrants in this country. So that also played a role in the kind of assistance that many received during the most urgent time, in their lives. So it was really difficult for us to play such a role during such a difficult time. So since last April, we have come together with two other organizations to create the Massachusetts Immigrant Collaborative, because there was an urgent need for us to do that. But that group, in addition to provide emergency support for immigrant families, we also wanted to work on vaccine equity. When Governor Baker rolled out his plan, we really felt that it was backwards. The people who needed to get vaccinated first seems to be left out for last. Um, the essential workers, members of our community who are on the front lines, and the people who didn't have a choice, who had to go out and work to provide for the families. And we're very upset, to be very honest, because those are the people who are being disproportionately impacted by COVID economically, but also by the disease, getting hurt, being infected, and getting sick, and also dying. So we started working with other communities, like the Black COVID Coalition and other groups, to advocate for vaccine equity. So vaccine equity is about really removing structural barriers that exist, that sometimes some of us can't see because they don't impact us the way they impact marginalized members in our society. For example, when someone asks you for a mass ID, you simply reach into your purse or wallet and you give it to them. But for someone who's undocumented, that's a serious question. It is something that will stress you because sometimes you don't have it, or someone in your family may not have it. For you to provide an ID to an agency, a government agency, is of great stress, because they can question your existence, your staying here. What is there a valid visa on your document? Why are you here? And so those are real problems and worries that exist in our immigrant community. Another one is going to one of those mega sites. Um, Many of our immigrant communities, they never been there. They don't even know how to get there. And you have to get through security. And that also another big stressor for them. So for us, it was very important to have vaccines in our community where members of our community spoke the language, understood the culture, and felt safe. Because the most important thing for us right now is to reach herd immunity. We want our community to have access to vaccines. We understand that, for us to get rid of COVID, everyone has to be vaccinated. Not some people, but everyone, right? Um, and so that's why it was really important for us to gain access to vaccines. Initially, as Senator Eldridge knows, it was very difficult because there was huge controlling on who could have vaccines. But with the support of the Lawyers for Civil Rights, we're able to early March to gain access to vaccines here. And as soon as members of our community heard that we had massive of calls and text messages, and everyone wanted. And what's interesting, so many people kept saying immigrant folks don't want to get vaccinated. We're going to have to do lots of education around, educating them the importance of the vaccine. But our experience was very different. People wanted to and felt that they really needed for the safety of themselves and family members, and to be able to go back to normal, right? Whatever that means, normal life, go back to work. So there was a huge urgency in our community to have access. So we're very, we feel very privileged that we're able to do that. So early March, we started to being able to hold vaccine clinics here at the center. We had today, actually, we had number 10. We had 230 people vaccinated today. Everyone just left. We're doing second doses. We're being able to have access to Moderna and also Pfizer. And in addition to being able to work with the Lawyers for Civil Rights, we also being able to form partnership with the city of Boston, the Boston Department of Public Health, and also the CIC Health through the Regis Center, who also gave us access to the back door for some members of our community that felt that with some support could go to Reggie Lewis Center, they also could go there. And in addition, they gave us a Sunday where 15 organizations came together to be there to welcome members of our community. And for that day, we had access to up to 800 vaccines on a Sunday to facilitate for members of our community to have access to vaccines. So at the end of the day, we all want the same thing. So, but it's very important that the structural barriers are removed so members of our community, whether documented or not, they are part of the society, and what happened to them matters if you want to get rid of COVID. So we're really glad that we have been able to play such an active role in supporting our community having access to vaccines. So we up to, I think, around over 2,000 since March. And we have 3 clinics this week, including one in East Boston in partnership with Centro Presente. And we're going to continue to work with our community to ensure that everyone who wants a vaccine and feel that he or she is not able to go to a mega site or doesn't feel comfortable going to a doctor or another place where they don't speak the language or might ask for documentation or health insurance, can come here. So thank you, Senator Eldridge, for providing this space so I can share some of our experience working with the community here at the center.
Great, thank you so much, Natalícia. Really appreciate it. Again, just from a constituent point of view, you have helped vaccinate, I would say, no doubt, hundreds of my constituents and thousands of people across the state. So thank you so much for your presentation. And now we have some questions that have been asked in the chat, and I'm just going to ask the person who asked the questions to will unmute that person and they can ask their questions. So the first person who asked a question after the panel from the medical doctors is Ann Roosevelt. So Ann, if you want to unmute yourself and ask your questions.
Muting. Oh, there it goes. Thanks. I had 2 questions. My questions are, is the vaccine safe for pregnant women? And has there been enough, study of that issue so that we could feel safe? And the second question is, could the doctors talk about the variants and how prevalent they are, and how much more contagious they are, and if they know how that contagion spreads? I mean, is it through the air as the regular vaccines, as the regular coronavirus is, or is it spread a different way? And how soon do we think there'll be vaccines for those?
I mean, I'll start off with the question about, is the vaccine safe for pregnant women? And yes, it is safe. And thankfully, now we've had thousands and thousands of pregnant women that have received the vaccine safely. There haven't been any documented deaths in pregnant women that have received the vaccine. And then, of course, there were some women that became pregnant during the trial, and they did not experience complications during their pregnancy. And we also know that you're more likely to die from infection during pregnancy from COVID, because COVID, is associated with increased risk of preterm delivery as well as death. And I'll let someone else address the variants.
Great, I can address the variants. So regarding the variants, as you know, probably from the news media, there's a fair amount of them out there, from the Brazilian variant to the UK variant, and then the latest variant from India. And then there's also regional variants as well that we actually don't get publicized much about. Like there's a North Carolinian one, there's like some stuff from the West Coast that we don't hear about that much. But let me just start off by saying that we expect that the virus is going to mutate. This is in the natural history of the virus, in the natural life cycle of the virus, that it mutates. So having variants is not a surprise to us in the medical world, and it's not a surprise knowing that this is a respiratory virus which mutates. That's why we get we advise new influenza flu vaccines every single year, because every single year these they mutate a little bit. Looking at the, I can only speak to in Boston, the variant that is most prevalent that we see as of a couple of weeks ago was looking at sewage data, was the UK variant. But I don't have any more recent data than that. And then in terms of how it's transferred or transmissibility, it's not that different than the COVID-19 that we've been having for the last year. So still, through through coughing, through surfaces, touching of hands on mouth, eyes, etc. So the transmission of it doesn't change, and hence the recommendations haven't changed that much in terms of constantly keeping to washing your hands and wearing a face mask. And then I think that the third part of your question, Anne, was when we would have a booster for it. Those are all currently being studied right now. And I think that the FDA and the CDC will come out with a joint recommendation alongside the WHO for when we would have a booster, if a booster is even needed, and then how we would get the booster. And I saw one question in the chat regarding the booster, which is if you got Moderna, do you need to get the Moderna booster? That's all going to still be kind of debated upon and discussed by the infectious disease experts and people who are working on these. So more guidance on that to come.
Great,
And I
thank
saw
you.
that message in the chat about the importance of emphasizing that now there's EUA, emergency use authorization, for the ages 12 to 15 for the Pfizer vaccine.
Excellent. Thank you, Dr. Chandler. Thank you, Dr. Duong. And I think addressed the question from Ian O'Brien. So I was going to go to Nick Herder, who had some questions about vaccination. Is Nick there? Herder?
Yeah, thanks, Senator Eldridge, and thanks to the panelists as well. Two questions. The first is, how does the EUA evaluation and approval process differ from the full FDA approval process? And my second question is, in your experience, what's the most effective way to respond to misinformed people who, are concerned about that conspiracy theory that there are microchips in the vaccines?
Yeah, in terms of the EUA versus the full approval, remember, emergency use authorization means that there's enough safety to outweigh potential risk. And then for the full approval, we need additional follow-up. There's a period of time that any therapeutic has to be observed once it's in wide use, or a period of time, 1 year to 2 years are needed to collect safety data. So Pfizer, they're planning to go for full approval, in the next few weeks. And they started their trial in April. So now they have a year's worth of phase 3 clinical trial data where they can say it appears relatively safe. And these clinical trials, they are slated to go for 25 months, Pfizer, Moderna, Johnson & Johnson. So the EUA versus full approval is all about getting more safety data. Safety as well as efficacy.
Excellent.
And then I'll let,
Diego? Oh, I'm sorry.
he had an additional question. I'll let David or
Oh, sure.
Wilfredo address.
Yeah, great. So I guess the next question here is from Anya O'Brien. Says, is there any more data as to how long the vaccines are effective, and how do we determine that? So essentially the short answer is that in order to say that the vaccine, how effective the vaccine is after 1 year, we have to have studied it up to that point. So, the Moderna and Pfizer trial started mid last year, so around like July, August or so. And so we're nearing, the 8 to 10 month mark. And so we can say that up to 8 to 10 months, the vaccines are really quite effective. And that data has thus far really held up. As Dr. Chandler mentioned, a lot of these trials are scheduled to go for at least 2 years. And by the time that point comes around, we'll have other ways of seeing how effective the vaccines are. And so as time goes by, we'll know with more certainty how the effectiveness changes. Does it stay the same? Does it go down? How fast is it going down if it does? And then we'll have a better idea as to what we'll need to do with regards to boosters and whatnot. So I think really it's a matter of time. What we do know for certain is that in this short amount of time that we've had them available, they're actually astonishingly effective. Hence why the recommendation that we should, all be rushing to get these essentially.
Let me go back to one of the other questions regarding addressing vaccine misinformation. That was a second question that Alex had. So addressing vaccine misinformation, it's unbelievable. I don't think I've ever seen so much misinformation in my professional life right now. And I think that the advice that I would give is to not disregard it, but to really listen to see where that person is coming from, and then where they're getting that information from, and why they choose to believe that source. Regarding your specific question about the microchips, I usually, I have some patients that ask me that, and I point to my phone and I'm like, if you're worried about microchips, this is currently tracking everything that you do. So you carry around a phone, don't you? So what is your real concern about this microchip? And then trying to engage. I also find that using in-language information is also really helpful, and mass.gov /COVID-19 has a lot of information in different languages that you can print out for pages for patients. And then thinking about, people's cultural values and speaking to that to combat vaccine misinformation. And I would be really curious to see my colleague, co-panelist, Dr. Tracy, given your work with the Brazilian Workers Association, if you've had to manage misinformation and how you've dealt with that.
Yes.
Sorry.
As you know, in a community, misinformation also sometimes it spreads like a wildfire. So we have to constantly manage that. And yes, the good information that has spread, that has helped, is that the Pfizer is a great vaccine against the Brazilian variant. So everyone wants to get Pfizer. At least a lot of the Brazilian community, which is a very large community in Massachusetts, is estimated to have 300,000 Brazilians living in Massachusetts. So that's helpful. But other misinformation is that some people have died from the vaccine, that some people had a horrible rash that will never go away. All kind of misinformation that we hear, that we constantly have to sort of misspell, right? But we do that by sometimes talking with them about having people in a community have the vaccine themselves. Like one thing that we do to sort of debunk some of that, for example, with the pregnant women, when the pregnant women show up to get vaccine, we ask them to take a picture with the sign, "I had my vaccine," and then they put on social media, right? And that helps. And then the next time we have other friends who wanted to get vaccinated. I think that's one thing that has helped a lot, is sort of really have members of the community themselves seeing themselves on social media and have them talking to one another. And I think there's nothing more powerful than them talking to each other, right? And the churches as well, having the pastor from a church come in with his wife and getting the vaccine and posing with other members of the church and put that on social media. So they use a community, use a WhatsApp and bazaars and Facebook and Instagram, but mostly bazaars, and they have all these social groups that they share information. And once you get that information through those chats, it's unbelievable how far it goes. So that's how we've been able to misspell some of that. And it has helped a great deal. We have a very small percentage of members of our community who are hesitant, but it's very small. And to be very honest, it's sad, but it's true. What's happening in Brazil right now is also scaring people to actually seeking vaccine here. And members of their community, family in Brazil is also telling them, go get vaccinated. We have few folks come here and being really upset and say, I wasn't thinking about it, I was nervous, but my family member from Brazil is telling me, go get vaccinated. You have access to vaccine, go get it. Can you hold my hand? I said, of course. You know what I mean? And there's nothing to be afraid of. So we had cases like that. And I think all community support, it's really important to support one another and show that this is the worst thing that can happen to you is if you don't have the vaccine. So you need to have the vaccine. That's the safest thing. So you can do for yourself and for our community right now is to get vaccinated.
And realize that for those people that are hesitant, don't give up. Keep on having the conversations, because oftentimes for Blacks, it's multiple conversations before those that are having challenges accepting it are willing to, because it's not always misinformation. It can be, well, I say misinformation is misinformation or disinformation, but also there are realistic, really, valid reasons that they may fear getting a vaccine because of prior experiences that they've had in the medical system or, everyday community experiences.
That's right. That's right. Yeah, some of the mistrust or distrust to sometimes the health system and what's happening is grounded on factual, right, historical incidents that they are holding on to, and we can't blame them. So we'll take a little while for them to say, I guess it's safe for me to do this.
So thank you so much, Natalícia. Thank you, Dr. Chandler. And I do want to encourage you, if people have questions, you could also raise your hand. And I see someone who has raised his hand is Diego Sanchez. So Diego, do you want to ask a question?
Gracias. Doctor Matias, ¿qué podrían hacer personas que no ciudadanos y no tienen papeles? ¿Y cómo pueden recibir tarjetas? Gracias.
Excelente. Bueno, le voy a responder primero en español y si me permite, le puedo traducir la pregunta para que los otros oigan. Ok, excelente. Según lo que yo tengo entendido, el hecho de que un paciente sea indocumentado, etcétera, eso no tiene que ver con ello poder recibir la vacuna. Es decir, cualquiera ahora aquí en el estado de Massachusetts puede recibir la vacuna. Es decir, que esa persona puede ir a cualquier sitio y se la dan sin problema. Eso no es una barrera para eso. Entonces, la recomendación sería eso, porque yo estoy de acuerdo y hay muchas personas que tienen miedo de que por eso ellos no tengan acceso a la vacuna, o peor, que si ellos van al médico se encuentren con problemas que tengan que ver con su ciudadanía. Y también quizá Natalícia podía comentar un poquito sobre eso, que yo creo que es un tema bastante importante. Ahora se lo voy a traducir en inglés para todo el mundo y después se lo paso a Natalícia. The question was individuals who are undocumented or who have concerns about their citizenship status, if, what can they do about getting access to the vaccine? And essentially, in brief, it's not a barrier to getting vaccinated. So here in Massachusetts, anybody who wants a vaccine now is eligible and can sign up to get one. I know there are, pharmacies as well who are taking walk-in appointments, no questions asked. And so it really shouldn't be a barrier to vaccination. And I would encourage people to kind of spread the word, because that's a very legitimate and important concern that exists in communities, with a large proportion of individuals who have concerns about their citizenship. And I guess I'll pass it on to Natalícia, who can add more if she'd like.
Thank you. So regardless of one's immigration status, Yes, and that's one of the major work we have done here at the center, is making sure that people understand that regardless of one's immigration status, you should be able to have access to vaccine. And also, you shouldn't be asking for documentation. You shouldn't be asking for your insurance card if you don't have one. You should be able to literally show any ID or no ID. Here at the center, sometimes they say ID or mass ID, and we're like, no, all we need is your correct name. You can write on a little piece of paper your name, print your name and your date of birth, and that should be enough information for you to get your vaccine. And but it is difficult sometimes when members of our community do not have enough confidence in the way they speak English, if they feel like English is, limited English proficiency, or maybe just for being undocumented. In those requirements I ask from them, from a figure of authority, they shy away. And that's why I think we have a waiting list here. Sometimes we recommended people to go to another location. They're like, well, can you put me on your waiting list, right? And because here they can come in and they know, if anyone says paper, we're like, yeah, a piece of paper for you to write your name and your date of birth. That's all we need, nothing else. And that's what's really important, our community understand that. The vaccine is free. We heard someone was charging for vaccine somewhere. I'm like, no, we got calls early on saying, how much is the vaccine? Do I really need to have health insurance? No, the vaccine is free. No one should charge you to drive you anywhere to get vaccine. No one should charge you for vaccine. No one should be demanding any type of documentation or any health insurance from you. This is something that if someone asks you for those things, you need to let someone knows that this is happening to you. It's absolute distortion and it's illegal, and you should not put up with that. No way, no. So everyone should get vaccine. So that's one of the work we're doing here at the center, is to make sure the community is not being scammed or mistreated when they're trying to get vaccinated. But I have to say, I have been getting calls that some of the pharmacies were not going to waive the right to get some proper IDs and health insurance, because I heard they have to get some kind of reimbursement, and they doubt that they can't get it. So so we're telling people there are other places you can go.
Great, thank you so much, Alicia. Thank you so much, Dr. Matias. I have a question from Eileen Zealous around the vaccine. Eileen, you want to ask your question? And maybe Eileen will come on in a little bit.
Yeah. Okay. So.
Eileen, hi.
Yeah. Hi. Okay. So, my question, which is in the chat, is we know that people are receiving the vaccine probably experience or mount different levels of immunity depending on their medical condition, their age. That can be true of even as we begin to, vaccinate younger kids with with some problem conditions. Can you just talk a little bit about that? And then also, I didn't want to bring in the whole controversy over masking, because you guys have done such an amazing job of just talking about the science and the vaccine, but in a way, some of this is related, because people are, people may have received the vaccine, but may not be immune. And yet when we're telling people that, that you don't have to wear a mask, they may be exposed to someone who isn't immune. So can you just comment on that? But the immunity issue.
Yeah, there's definitely different levels of immunity achieved. And we know that people, for example, that have cancer and are receiving chemotherapy, they may not mount much of an immune response. And so we are seeing people that have had both doses of the vaccine and they're being hospitalized and their systems are not clearing the infection, the COVID infection. And of course, we have those cases that have already been reported where people have gotten both doses of the vaccine, and certain people in a nursing home, they became infected. There's been at least one death reported. So we still want to practice those other public health measures, wearing your mask, physical distancing for maximum protection. And especially when you're in closed settings. We know outdoors, it doesn't there's not as much infection. But if you want to have maximum protection, wear your mask, practice physical distancing.
Great, thank you so much, Dr. Chandler. I see a question from Ralph Edwards, one of the co-chairs of the Public Policy Subcommittee. Ralph, can you hear us?
You might have to just read Ralph's question out of the chat. I'm not sure he has a microphone on his computer.
Sure. Yep. So Ralph Edwards, he asks, a Canadian friend was granted emergency entrance to the U.S. to arrange hospice care for a patient. Are they eligible to receive their second Pfizer vaccination in Massachusetts? So I don't know who might know the answer to that.
Yeah, I mean, this gets back to the question. I mean, you go to any walk-up site and you can get vaccinated. It's the same, like undocumented workers are able to get vaccinated. Anyone can get vaccinated.
I will just say that the governor's guidance, though, so yes, to Dr. Chandler's comment that anyone can get vaccinated in the state of Massachusetts, the governor's guidance is if you are working or going to school, employed, or a resident of Massachusetts, that you can get vaccinated. So I just want to throw that out there as that's the official guidance, but they should not be requiring any documentation.
Thank you. Question from Bill Shemeth. Bill, can you hear us? I'll ask the question. It's a question from William Shemeth. How can you reassure parents who have students who have younger kids aged 12 to 15 who are smaller in physical size that the dosage will be safe?
Yeah. So I'm happy to answer that one. So I think this goes back to the conversation we had earlier about thinking about the different steps that vaccines have to go through before they get authorized by the FDA, right? So they have to go through phase 1, phase 2, and phase 3 trials, and then the FDA will review all of that data and say whether they're safe to use. And so, you know, this breaking news that the FDA has authorized it means that this vaccine has already gone through all of those steps in kids who are age 12 to 15. So that means already back in phase 1 and phase 2, they've already tried different doses in populations of kids who are different weights, et cetera. And so the current dose that they're using is ones that has already been validated. And so you know, I would say it's similar. It's you know, we trust the process that has told us that it's safe in adults, and we're applying that same approach to kids. So so yeah, I would say it's definitely it's safe in kids as well.
Great, thank you so much. We do have some other raised hands. Steve Leibowitz, have a question?
Thank you. Thank you, Senator. Thank you to our panel. One of the things I wanted to ask about, getting back to some of the science and how we should approach things after we're vaccinated, is what the data is showing in terms of whether or not someone who is vaccinated still has the ability to spread the virus to other people.
Yeah, I mean, the data is suggesting that there is reduced transmission, and we have that coming out of Israel, reduced transmission. And now also we have some, you know, some data even in the US that there is reduced transmission once people are vaccinated. Even if they have asymptomatic carriage, reduced transmission. So they're less likely even have asymptomatic disease than someone that's not vaccinated.
Great, thank you so much, Dr. Chandler. Thank you, Steve. See, Kevin Costa has his hand raised. Kevin?
Yeah, I just wanted to express one experience that I had and also pose a question. I remember, you know, having conversations with a friend over the phone, right? Haven't seen her in person in quite a while, a bit of a distance. And even though in the past we did plan on getting together, but because of COVID, we haven't. But she was, very intelligent. But sometimes when it comes to scientific studies and so forth, she seeks stuff that's, contradicts it, right? And there's a lot of stuff out there that says that can be problematic. And, and she's wise, she's got a great heart, but she was against this, and she was seeking out all the information supposedly, as to why not to, right? And then we'd have these arguments, and I try to be rational as to why that's not the case, right? Comparing studies and so forth. And then I had a bit of a breakthrough. And I'm not saying I convinced her, but in a moment where, we were getting passionate, right? And it was supposedly intellectual. And then I say, damn it, if something happens to you, and she's older, and you get COVID, and you suffer, and God forbid you die, I would never be able to live with myself. And that's why I'm arguing with you. And she paused. And now she's kind of like, so it went from trying to, I know more than you, right? And the defensiveness on her part, to she was like, oh, wait a minute. This is, I'm not saying that Kevin's right, but he really believes that what he's doing is correct, and he's doing it for all the best intentions, including my well-being. And I think that there was a bit of a movement now, and now she's reconsidering. And my question would be, I'm thinking, people have been vaccinated. And I remember the nursing homes. I lost my father, not even sure if it was COVID or not, just over about a year ago in a nursing home. Oh, but a lot of people have died in nursing homes, and they were some of the first vaccinated, and the death rate plummeted. And, I remember I would always get a flu vaccine, because the last thing I wanted to do when I visited my father and my friends in the nursing home, and not so much for myself, is like be the cause of their suffering. But we don't know specifically who, but we can know with confidence, I'm thinking, that there are people, in this country that have been vaccinated. And for having been vaccinated, there are a bunch who have saved their own lives and saved themselves some great suffering. And there are people out there who have gotten vaccinated, and they might not have saved themselves from suffering and death, but they've saved others, including conceivably loved ones. And we don't know who they are. And it's even conceivable some of us who were vaccinated, for all we know. I'm not saying it's likely, but we could have. Right. And so the idea that, this is something, not a zero-sum game where, more for me means less for you, far from it. By helping yourself, you're helping others. And so it's something that, the people who've developed these vaccines and done this work, sometimes they're in the dark shadows, people don't pay attention, but they've dedicated their lives to this kind of thing, and you guys have as well, and we're the great beneficiaries of it. So thank you. And this webinar itself is an instance of such dedication. So thank you, and thank you for your patience with me.
Thanks.
Thank
Kevin.
you so much, Kevin. Good to hear from you. I had a question for Natalícia Tracy, and Natalícia, you talked about, part of your criticism of Governor Baker's rollout of who would get prioritized to be vaccinated. That's something that a lot of us in the legislature had frustration with as well. And I'm just, if you could talk a little bit about what you would have preferred to see in terms of how the vaccination rollout happened in Massachusetts, especially to vulnerable populations.
Well, I really felt that, I understood that he needed to have phases, right? But I really felt that he should have created phases based on people who had to go to work. Like if you were an essential worker and you had to be out, you couldn't be home, and you had to be driving, being public transportation, carpooling, had to be in essential jobs that you had to be out there. I felt like those people, those, working people, immigrants or whoever they were, in this case, most of them were minority that did not have an option to stay home, sitting in the comfort of their home in Zoom meetings, they should have been the ones who got vaccinated first, because and then everyone else who had the chance to stay home could have stayed home another month longer, because I really felt that those are the people that couldn't have waited to be vaccinated, right? And I felt like he used politics. I'm sorry, but I'm pretty honest with this stuff. He let politics get in the way to create a structure that was based on necessity, instead of the people of the Commonwealth of working class than what was needed then. I really think that it took a lot longer for the vaccine to get what it needed to get. And that's my thoughts on that. And people, I think a lot more people who got sick and even died wouldn't have got sick and dying if they had the opportunity to get vaccinated early on. And the vaccines were being controlled or pulled out of hospital or pulled out of clinics, and was really controlled when it should have been liberally kept it open for anyone who wanted to be vaccinated right away, because we had those vaccines. But again, politics.
Right. No, thank you so much for being outspoken. I really appreciate that. And not necessarily a critique of the Biden-Polito administration, though I'm always comfortable with that. But I'm just wondering if the medical panel, if you just have any comments about what areas where Massachusetts was, weak, or there were gaps that you would have preferred to see some changes in terms of prioritization of vaccinations or targeted approaches.
Can I say one more thing?
Oh, yeah.
If you look at the vaccination rate for Massachusetts, even now, 52% of people who have received at least one vaccine are white, almost 53%, 35% are Black, and 30% are Latinos, right? And then if you look at the population of people, workers who are out there, you look at who has to be out there, the essential workers, it's the reverse, right? So that tells you something. Who has to ride public transportation, who has to be carpooling, who has to be doing the essential work, who has in constant contact with other people and actually in constant interaction with other people. Though if you reverse that, those are the people who who haven't been vaccinated yet. So and that's my argument, that that might, I hate to say, but we would have maybe achieved herd immunity if you had reversed in Massachusetts, if we had done this earlier. Now we're at risk of not getting that, right?
Absolutely. Thank you. I don't know if any of the medical panel wanted to comment on where you saw some gaps.
Right. I mean, one key example is that we want to have, when you think about how to vaccinate the populations at greatest risk for having complications and dying from the disease, you want to get the vaccine closest to where the disease is. So when they set up the mass vaccination sites, they overlooked getting a site near, Roxbury and Dorchester. So, Boston Black COVID Coalition really had to push that a site be set up in Roxbury, and that's how the Reggie Lewis Center site was set up, to offer vaccinations in a community, in neighboring communities that they were really hard hit. So always think about getting the vaccine closest to where the disease is when you think about the rollout.
Yeah.
Thank you, Dr. Chandler. Yeah. Go ahead. Sorry.
No, I don't have much to add, Senator. I agree with both those points. I think, for me, early on, there was a lot of conversation as to whether we should be focusing on equity or whether we should be focusing on speed. And it was kind of this like polarizing thing, as if we should like do one or the other. And, there were like, throughout all of that, I was just kind of like, we can do both, right? Like, there's no reason why we should kind of, just say, oh, this is the only way at the expense of that. And so I just wish the conversation would have been a little bit different. Let's think about how to be, equity can be done with speed. And if you do something quickly, we're not going to reach herd immunity quickly if we don't focus on equity. So, speed may not necessarily get us to where we need quickly without equity. And so I think that it was this like false dichotomy that was created early on that that slowed us down in the end, I think.
Great, thanks so much. And we have time for one more question before we're going to highlight vaccination resources from Liz Coughlin. Liz, do you have a question? Can you hear us, Liz?
Can you
Hi,
unmute
Liz.
me?
We can hear you. Go ahead, ask your question.
Okay. Thank you, Senator. I wanted to make a comment on the availability for essential workers and the designation of who was an essential worker. It had come to my attention that undertakers and embalmers were not in that group, and there was a lot of stress in that working community for obvious reasons. And I just wanted to bring that to your attention in that discussion about who's an essential worker that, should be getting protected in the front line. And also I want to thank, this has been excellent, and I want to thank the doctors and other people that have spoken. Thank you.
Great, thanks so much, Liz. And you're still in a bit of my thunder. I'm going to close out tonight's webinar on COVID-19 vaccines and the mass vaccination plan. And I want to echo what Liz just said and thank Dr. Chandler, Dr. Matias, Dr. Duong for the medical presentation. Very helpful and really getting to answering specific concerns, as well as how to move some people that still have some hesitancy about the getting the vaccination. And I want to give a tremendous thank you also to Dr. Natalícia Tracy of the Brazilian Workers Center, who again has just done incredible work at spreading the word, especially with the Latino and Brazilian immigrant communities. So thank you all. And we Mass Democratic Party through the Public Policy Subcommittee, again chaired by myself, Martina Jackson, and Roosevelt and Ralph Edwards. We have put together some materials on the Mass Democratic Party website. Allison Mitchell with the state party, who also just want to thank you for your tremendous help in putting tonight's webinar together. There are resources on the website, texting your zip code to get vax, finding a vaccination site online, calling Massachusetts 211, and a listing by municipality of vaccination resources. I will just say, I represent a Metro West district. We just got our second regional vaccination clinic up and running out in Devon's, sort of focus on rural communities in north central Massachusetts. And, it's up and running. People can go to the VaxFinder website and schedule a vaccination for this Wednesday. We know that there's still millions of people in Massachusetts who have not yet received the vaccination. So just want to thank everyone for attending tonight. Please take a look at those resources. And again, I want to thank all the presenters tonight for your excellent presentation. This has been recorded, so we'll be sharing it and trying to get out the word, especially through Democratic town and city committees and local cable TV. So thanks everyone, and have a great night, and keep up the outreach and spread the word. Just stay safe and healthy. Thanks so much.